And I would think diabetes would be affected pretty easily because it's very dependent on taking care of yourself, eating right, and exercise, those kinds of things. Cancer, terminal illness, a lot of depression, a lot of anxiety, chronic pain. You know, it's just really hard. What we know about people that feel suicidal is they don't see any way out. You know, their problem, they just can't get around it, they can't get their head around it. And so having a good pain management plan is real helpful with these people. Chronic pain and terminal illness may increase the thoughts of suicide. Some of our suicides, especially with older people, chronic pain is a big issue. And I can't talk them into pain clinics here. I'm always trying to talk people into trying pain clinics because they're so helpful. Also, the other way, if you have untreated stress, that can lead to serious illness too. If the stress is unresolved, I think this is true of our vets, a lot of our vets. They just don't know what to do next. A lot of our employers, especially locally, are small employers. They can't hold the jobs open until they come back, you know, so they've lost jobs. People who are really stressed can get very ill too. And so then it's like, who came first, the chicken or the egg? And it just goes on and on and on, which one came first. So we've taken some action with that. What are we doing in Shiawassee County? Well, we are doing some things. We have a place, a corporation called Health Delivery that has the Shiawassee Community Health Center. And they're out on State Road, across from Myers. My sister happens to be the doctor there. So they have a really intense program. Let me pass these out to you. This is some of the services that they provide out there. And you'll see that they do a patient questionnaire. Now, a lot of the family docs don't do this kind of stuff yet. Yeah, we've kind of got to teach them to do this. My dad was extremely depressed and probably quite suicidal. And my son and I both told him, you have to go tell the doctor you're depressed, because the doctor just wasn't getting it. And they put him on Paxil, and he was very happy, you know, until he died. He really had a nice quality piece of life. The Integrated Health Program, we're a pilot project. Started on June 22nd, 2009, and it's met their initial goals. We have a lady out there named Kayla Harwood. She's a co-employee of Health BI and ours. She's our employee too. And they keep her really, really busy. So if Renee sees someone for a physical problem, or they're screened and there's some signs of depression, or you know, maybe she's had a death in the family, or she needs some help with something, she can send that client right over to Kayla the same day. There's no waiting, doesn't have to be tomorrow, next week. She'll just take her around to Kayla's office, and Kayla can start work with her then. And then sometimes they're referred here if they need more. They have protocols, staff forms, they have a manual, and now we've spread to Perry. Kayla goes to Perry one day a week with the Perry Family Practice. So it'd be nice if we can spread it. We'll spread Kayla real thin, spread it all over the county. They've done a long-term study on depression, and all new patients get this public patient health questionnaire. They look for symptoms of depression and call them a new intake person appointment and start it right out at that time, and then they can follow right up with us. Nice thing about the health center is it's mostly for people with Medicaid or no insurance. If they have no insurance, we can try to get them to apply for Medicaid. We have a lot of underinsured in this county, a lot of people that have jobs, so they can't get Medicaid, but they just don't have insurance that covers anything or have any insurance at all. and they can help with medications and lab tests. This is a federal program. So unfortunately, we were considered a county that, for federal funding, that was in pretty tough shape. So that's how they got the federal funding for us. I found a quote. It's illogical, but I guess you could take a vitamin in the morning and die by suicide in the PM. And I think that's such a true thing. It's something we see all the time. And I kind of condensed that all together really quickly.
Good job.
So, but I did want you to know that anytime you can talk up integrated healthcare, please do, because we'll be out talking to all the doctors and med techs, psych techs.
They'll have to. We'll all be in the same foxhole soon, financially, so that we'll have to work together a little bit better. Everybody will have to do that all day. So.
Well, they don't. You know, people are comfortable with it, what they know how to do. I've had doctors say to me that I would never work with a mentally ill person. And I think, well, that's a bad thing to say. But on the other hand, I probably wouldn't want to do surgery either. So, you know.
Unfortunately, I've talked to people, you know, as they've gone through medical school. It's an improvement. They used to get absolutely no training in terms of mental health and diagnosing it, or recognizing it, I should say. Now they get about, in medical school, depending on which medical school you do, about that much. And so it is a very, I commend, Shiawassee and your colleagues for saying we're going to make an inroad on this and start getting doctors to recognize that we've got to deal with this.
Got to work together.
Thank you.
Thank you very much.